everyone. My name is Jaisal Tiwarain, your student nurse for today, and I'm going to assist the client for the oral hygiene. So this is the brushing and the flossing of the teeth, including the inspection of the mouth for the dental caries, gums problems, soft plaque deposits, etc. So the purpose of this is that to cleanse the teeth of food residue and the microorganisms, to maintain moisture and integrity of the tissue, to refresh the mouth, to improve the pleasure of eating, and then to prevent the oral infection, to relieve discomfort from inflammation or the inflamed lesions, and then to prevent dental caries, and lastly to maintain or improve the self-concept. So we will do first the independent client. So in order for us to proceed the procedure in the oral hygiene, we will gather the equipment first for the independent client. So first, we will have the toothbrush, next toothpaste, emulsion basin, glass of water, towel, the mouthwash is optional, the dental floss is optional, petroleum jelly is also an optional, and lastly, the working gloves. So, these are the step-by-step process of the procedure in oral hygiene. So, identify and explain the procedure to the client, and an explanation facilitates operation. Sir, good afternoon. What is your name? And your birthday?
July 20, 2012.
So, sir, I am here to assist you for the oral. So, brushing your teeth will help you to make your teeth healthy, good looking, and also it is the most important thing as a children. We will now bring the equipment to the bedside because organization facilitates the performance of the task.
Provide privacy for the client. The client may be embarrassed if cleaning involves removal dentures. After we provide the privacy for the client,
we will wash our hands and then don gloving. Hand washing deters the spread of microorganisms.
After donning gloves, arrange the equipment within client's reach. This facilitates self-care.
Next is that assist the client to the sitting position if permitted, or help him turn to one side. Sir, are you okay with your position now? Okay. Since he is already sitting, so I will just arrange him lightly. Because a sitting or a side-lying position prevents aspiration of fluids into the lungs. Next, place the bath towel across the chest.
The towel protects the client from dampness. And then raise the bed to comfortable working position. Raising the bed promotes efficient body mechanics.
After that, encourage the client to brush his own teeth or assist if necessary. First, we will moisten the toothbrush and apply toothpaste. Sir, kuha ang toothbrush. Dito sa tubig. Ayaw gunitin na ako lang dyan magunit na namin. Ako lang mag-assist. Brush, put ang toothpaste. Place the brush at the 45-degree angle to the gum line and brush from the gum line to the crown of each tooth. Brush the outer and the inner surfaces of the tooth. Brush back and forth across the biting surface of each tooth. Brushing facilitates the removal of plaque and tartar. Angling the brush permits cleansing of all surfaces of the teeth.
Brush the tongue gently with a toothbrush. This removes any coating that may be on the tongue. Gentle motion does not stimulate the gag reflex. Have the client rinse vigorously with water and spit into the emesis basin. Repeat until it clear. Vigorous swishing helps remove loosened debris. Assist the client to floss the teeth if it is necessary. Flossing aids in the removal of plaque and promotes healthy gum tissue. Offer a mouthwash if the client prefers. A flavored mouthwash leaves a pleasant aftertaste. If our client has a denture, assist the client with the removal and cleansing of dentures if it is necessary. Artificial dental devices can be more thoroughly cleaned when removed from the mouth. So first, we will apply gentle pressure with a 4x4 gauge to gasp and remove the upper denture cap. Lift the lower denture using a slight rocking motion and place in the denture cap. A rocking motion breaks the junction between the denture and gum. Using a 4x4 gauge prevents slippage and the spread of microorganisms. Next, if the client prefers, add denture cleanser to the cap with water and follow the package direction for cleaning. Brush all areas thoroughly with a toothbrush and toothpaste. Rinse denture thoroughly with the water in as basin spread with a washcloth. Return denture to the client after cleaning it. The basin with washcloth will protect the dentures from breakage in case it is accidentally dropped. Offer mouthwash if the client prefers. A mouthwash leaves a pleasant aftertaste. And after that, apply petroleum jelly to the lips if needed. Through petroleum jelly, it prevents cracking and drying of the lips.
After everything, assist the client to a safe and comfortable position. This prevents uncancelled or unnecessary discomfort.
Okay, sir, ihigda na takagbalik ha. This prevents uncalled or unnecessary discomfort. After assessing the client to a safe and comfortable position, do the aftercare of the equipment for a healthy and clean environment for the client. And then remove gloves and wash your hands because hand washing deters spread of microorganisms. And lastly, record the procedure done and the client's responses. Charting provides accurate documentation of client's care. Good morning, everyone. My name is Jaisal Tiwarain and I'm going to assist independent client for the oral hygiene.
So this is the brushing and the flossing of the teeth, including the inspection of the mouth for the dental caries, gums problems, soft plaque deposits, etc. So the purpose of this is that to cleanse the teeth of food residue and the microorganisms, to maintain moisture and integrity of the tissue, to refresh the mouth, to improve the pleasure of eating, and then to prevent the oral infection, to relieve discomfort from inflammation or the inflamed lesions, and then to prevent dental caries, and lastly to maintain or improve the self-concept. So these are the equipments that we will gonna use for the dependent client in oral hygiene. So the first one is that the toothbrush, next is toothpaste, the kidney basin, a glass of water, drinking straw, towel, and then the potted tongue depressor, and mouthwash solution, lubricating jelly, and then the working gloves. And also cleansing agent, the hydrogen peroxide at half strength, suction apparatus with catheter, it is optional, and lastly is that a septo syringe, and that is also an optional.
These are the step-by-step process of the procedure. Identify and explain the procedure to the client. An explanation facilitates cooperation. Oral hygiene will keep your mouth clean and this will also a prevention of dental cavities. Bring the equipment to the bedside because organization facilitates the performance of tasks. Next, provide privacy for the client. The client may be embarrassed if cleaning involves removal dentures. After that, wash your hands and don gloves. Hand washing reduces the transient microorganisms, thus deters the spread to client and self.
Now, adjust the height of the bed, lower the side rail nearest you. Since we don't have the rail here, just imagine that we have one. And then, it helps to prevent unnecessary stretching and twisting of muscles, part of the nerves. Position the client on his side with his head turned toward the nurse and tilted toward the mattress. A side-lying position with the head turned downward prevents aspiration of fluid into the lungs. Now place the bath towel across the chest and kidney basin in a position under the client's chin.
A towel and the kidney basin protect the client from dampness. Open the mouth and gently insert the padded tongue depressor between the back molars. A padded tongue depressor keeps the mouth open for easier cleaning and prevents the client from biting the nurse's fingers. If the client has his natural teeth, clean them carefully with a moistened padded tongue blade or toothbrush. Remove dentures if present and clean. Use a gaze or padded tongue depressor moistened with hydrogen peroxide to gently cleanse the gums, mucous membranes, and tongue. A toothbrush and padded depressor blade provide friction necessary to clean areas where plaque and tartar accumulate. Hydrogen peroxide solution effectively cleans and removes incrustation from the oral cavity. Rinse with small amount of water or use a gaze padded tongue depressor in mouthwash solution to rinse the oral cavity. Position head to the side to allow return drainage of water or use suction or a septosyringe. Rinsing helps to clean debris from the mouth. After rinsing the client's mouth, we will use a dry cloth and then wipe the client's mouth. This prevents skin irritation. Apply lubricating jelly to client's lips. Lubrication prevents drying and cracking of the lips. After that, place the client to a comfortable position. Leave client in a lateral position with the head turned toward the side for 30 to 60 minutes after oral hygiene. And then remove towel. This prevents pulling of secretion and aspirations. And after that, do the aftercare. Proper care of the soiled equipment maintains medical asepsis. Now remove your gloves and then wash your hands. Hand washing reduces the transient of microorganisms, thus deters the spread to client and self. Document the procedure done and any unusual observation including bleeding, inflammation, tartar, and etc. Written information documents the individualized care given to the client.